Hi, I'm Cameron. I'm here with Dr. Maheshwari at Texas Pain Intervention Clinic. Dr. Maheshwari, the biggest buzzwords today is really about regenerative medicine. I want to know what's the truth and what's really hype, because I feel like you can get a regenerative PRP package on Groupon for $399, but then some places are charging $30,000 for this. Can you please tell me what is regenerative medicine?
Great question, Cameron. And first thing, don't follow the hype around it. It is a rapidly evolving field of medicine, and there are some good outcomes. But don't follow that one-page advertisement of getting stem cells for rejuvenation or getting stem cells to treat a serious medical or neurological illness. The data behind all of this is still largely absent. But there is some good data surrounding the use of PRP and bone marrow concentrate when it comes to rehabilitating tissue injury.
So if my boyfriend broke his leg, can I get a PRP injury and can he go back dancing with me the next weekend?
Oh, it's not that quick. I wish it was.
Oh.
So yes, it can help recover, but it's not something that's offered right away in the treatment, especially in younger folks. Let physical therapy work. Try out some simpler treatments and analgesic medications before you think of this option. But when you do, it could be a very good option to treat tendinopathies, tendinitis, things like golfer's elbow, tennis elbow, sports injuries, ankle injuries, even osteoarthritis affecting small or large joints. We have a good body of evidence now, and more data is coming in, that when done in the right fashion, these treatments work. Now, that takes me to the part, to answer the question, what is the right way of doing it? And that's one of the problems with regenerative medicine, is that people are following all sorts of protocols and injecting PRP or bone marrow concentrate, which has been isolated in just a ton of different ways. Oftentimes, patients don't know what they're getting. So, to give you an example, PRP is obtained from your own blood. PRP means platelet-rich plasma. Okay. Now, this is done by drawing your own blood, spinning it in a centrifuge, and processing it in a way where we can get a concentrated amount of platelets, which also includes growth factors and factors that help either drive inflammation or decrease inflammation, as the case may be. And your treating doctor or physician has to be mindful of exactly what type of product they're injecting and where they're injecting it. Are they following the evidence behind it or not?
So you're telling me all PRP or bone marrow aspirate are not created equal. And so how is Texas Pain Intervention Clinic giving me the best medical, safe quality that I should be getting?
Great question. At Texas Pain Intervention Clinic, I wouldn't do anything for you that I wouldn't do for my own family. And keeping that sentiment in line, I try to offer the best of everything. I do a lot of research, only offer evidence-based treatments to my patients, and only use high-quality equipment and precision guided injections. I've had extensive training in doing these. I utilize state-of-the-art X-ray, ultrasound to deliver these injections. And I also partner with the best processing equipment in the industry to get the best product. The count of platelets and the count of cells when we talk about regenerative medicine makes a big difference on the outcome. A small test tube can be used to process this, while a very sophisticated kit can also be used to process this. So you need to know what you're getting, how they're processing, are they counting their cells before it is being administered to you, and that really does translate into a better outcome.